Okay, so in this part of the video, I'm gonna be doing a dressing change. For these, I'm gonna need the supplies, which is my biohazard bag, my gloves, alcohol, 4x4. These are to remove the old dressing. We need our bio patch and our dressing change tray. So these are the things that we are gonna need. At this point, we are already in the patient's room. We have already introduced ourselves, hand sanitized. We already identified our patient. We already checked for allergies, and we already assessed the patient as well. We assessed the size, the site, and checked that our lumens were closed. And now we're gonna go ahead and start with the removal of the old dressing. So for that, I'm gonna place my biohazard bag right next to the patient, and I'm gonna go ahead and sanitize. So I would grab my sanitizer, sanitize my hands, and I would grab my clean gloves, put them on. Like I said, at this point we already checked for no drainage, malodor, no edema, the face or the arm. There's nothing, there's no blood, lumens are closed. I am perfectly ready to remove the old dressing. So like I said, for that I will need clean gloves, my 4x4, and the alcohol. So another thing I would do is I would have my mask on, because I am getting close to the, we want to reduce the chances of infection. So I would have my mask on, and I would grab my alcohol, open it, and then I would start removing my old dressing. This, we would do it, it's gonna be hard because it's really taped in here, but we would do it in this way. We're gonna go around it, trying to remove all the tegaderm, like from the outer parts first with the alcohol swab. Make sure not to touch the middle. You wanna stay away from the lumen that's inside the patient, like I said, to reduce the risk of infection. And just gently remove, and also the body oils of the patient will help for the removal. And then keep with the alcohol, you would keep doing this until it's all loosened up. And once you get towards the middle, you're gonna careful not to touch the middle. Once it's loose, completely loose, you're gonna throw your alcohol, and you're gonna secure the lumens, and you're gonna remove the tegaderm, and the bio patch is gonna come off too, along with these. Also, by this time, you would already have your 4x4 open. It should already be open here. I forgot, because you need to stabilize these at all times. And you would grab your 4x4 by the corner. Never touch the middle, because the middle is sterile. And you're gonna grab it by the corner, and you're just gonna place it on top, and just drop it there, and leave it there. At this point, you would remove your gloves and sanitize, wash your hands, and you can also remove your mask, because in your kit there's gonna be a new mask. You can throw that one away. And at this point, you're gonna set up your sterile field. Your hands are clean, so you're gonna start by wiping the table. And then I have my tray, and I have my bio patch. So I like to start by opening my bio patch and placing it here, so I can have it ready to drop it onto my sterile field. I'm gonna open my tray, all the edges, or open and away, careful not to cross. And then you throw it, and then the first thing you have will be your mask. So you're gonna grab your mask and put it on, and then the next thing you're gonna have is your gloves. you're gonna grab your gloves by the corner. Careful not to contaminate anything. And you're gonna set them up to the side so you can put them on later. And then you're gonna come in here, and by the corner you're gonna grab your drape, extend it. Careful to stay within your 1-inch border. Open it, and the shiny side will go down. My table is very small, so I'm just gonna be verbalizing here what I would do. And I would place my drape shiny side down, and careful to stay within my 1-inch border at all the times. And then I would next thing I would do before putting my gloves on is I would grab my bio patch and I would throw it onto the sterile field. Throw that away, and now I can put my gloves on. So I come over here, put my sterile gloves back on. Like I said, this isn't happening, but I don't have space. I'm gonna put on my sterile gloves. I'm gonna throw this away. And then I would continue on to setting up the rest of my sterile field, my 1-inch border, and I'm gonna drop everything onto it to the middle. First I have my Tegaderm. I'm gonna put it over here. It's the last thing I'm gonna use. Well, actually the last thing I'm gonna use is the tape. So I grab my tape and I'm gonna put it right here. Stay within my 1-inch border, and then I'm gonna grab the next thing is my iodide. I'm gonna put it right here, and then I'm gonna grab my alcohol swabs, and then I'm gonna grab my tweezers that I don't need right now, but I'll put them in there. And by the way, this is the same process that you would use when removing the central line as well, but for this video I'm just doing the dressing change. And then I would grab my my 4x4 and put it there, and my measuring tape, and I grab it and I make sure I have it in centimeters and get it ready to measure. And I drop it onto my sterile field. I grab my 2x2 and iodide, drop everything onto my sterile field, throw that away. And now I'm ready to come over here and start cleaning my area. So I would come and remove my gauze, and I'm gonna start cleaning with my alcohol. And I'm gonna clean 3 times. So I'm gonna remove my gauze, my 4x4 from the middle, because remember that's what's still sterile, and throw it in our biohazard bag, and I'm gonna start cleaning. So I'm gonna grab my first alcohol swab, and I'm gonna start cleaning in a circular motion from the middle and get a good friction and clean around it. Never come back to the center. Always move in circular motions. Never come back to the same place. This is too small, but you would just keep cleaning and circular motion around it, even to the neck. And throw it, and you do the same steps with the 3 alcohol swabs. You go on top of the line. You want to get, like I said, good friction all over on top of them. And then the last one, again, same motion around it all the way to the neck. Same thing. Get a good grab of everything, throw it away. You already used your 3 swabs, and then you're gonna allow it to dry, and then you're gonna proceed to your iodine. Like I said, we already checked our patient. He's not allergic to iodine or tape. I will open these, and then it's already dry, so I'm gonna start with my iodine. again, same type of motion. You start in the center, in the middle, with a good friction. In real life, this would be sutured right here, so it would not move, so you can get good friction going on there, so you can clean really well. Never go back to the same part where you started. Clean circular motions around your neck, and then do all 3 of them. Same thing for all 3 swabs, all the way. And then your 3rd one. Okay. And you clean. Okay, so I've already used my 3 swabs. I'm gonna throw that in there. I'm going to allow it to dry, and so this isn't gonna dry, but we're gonna suppose it's already dry. So the next thing we're gonna do is we're gonna go ahead and measure. So we're gonna grab, careful not to contaminate your sterile field, so we're gonna grab our measuring tape, which is already preset 2 centimeters, and we're gonna measure the line from the lumen right here, the space. And the reason for doing this, so this is where it's sutured, and then this is the part that we need to measure and document it. So in this case, it's very small. I'm gonna say it's 1 centimeter. And the reason we do this is because we want to have documentation to make sure that the line did not move in and out and in again, because that will just cause its reason for infection. And remember, we're trying to avoid that at all costs. So once we've measured it, we will document it, and then we can throw this in our biohazard bag. And now we are ready to put on our bio patch. So I'm gonna come in here and I'm gonna grab it from my sterile field, and we're gonna put out our bio patch in this way, with the lids facing the suture part like this, and you're just gonna put it on there. It should stay there in real life. And then we would come over here and we would grab our tegaderm, and we would put our tegaderm on top of it, open it. We can throw this in our biohazard bag. And this patient is really small, but this tegaderm would be perfect for a human or normal patient. We would put it snug on top, covering the bio patch and covering very tightly all the parts around it. Like I said, it's hard because this is a small, it doesn't even have enough room to put all the big tegaderm on it. But in a real patient, you would have plenty of room to put it all tug tightly around. And then once it's snug, you would take off these papers and just take it all. At this point, it's already sealed. And the next thing you would do is you would initial it. You would initial date and time, and then you would label your tegaderm, your new seal. And then the last thing you would do is you are gonna grab, you would put this on, and once it's already there, labeled and everything, pretend we're already there, you're gonna grab your tape from your sterile field, and the last thing you're gonna do is you're gonna secure your lines, your lumens, with a little piece of tape, so that in case it pulls at any time, you're gonna secure it right here. It's not pulling directly from the patient, but from the lumens. So that's the reason to put on the tape. Once you're done, this is the end of it. You would reassess your patient, ask for pain. You would reposition your patient, make him comfortable, and you would wash your hands, clean up your space and everything, and then you would follow with patient education. You would let them know what to do and not to do. This in this case around, we just did the dressing change, so just educate the patient not to pull it and be careful when they're moving, when they shower, to cover it so that they don't get it soaking wet, because that's reason for infection